Hello everyone, this is Soujanya Emanuelu. Today I'm going to talk about gastroesophageal reflux disease. Acid reflux is when some of the acid content of the stomach flows up into the esophagus, into the gullet, which moves food down from the mouth. Despite the name, heartburn has nothing to do with the heart. The stomach contains hydrochloric acid, a strong acid that helps break down food and protect against pathogens such as bacteria. The lining of the stomach is specially adapted to protect it from the powerful acid, but the esophagus is not protected. A ring of muscle, the gastroesophageal sphincter, normally acts as a valve that lets food into the stomach but not back up into the esophagus. When this valve reels and stomach contents are regulated into the esophagus, the symptoms of acid reflux are felt such as heartburn. So now we will see causes of GERD acid reflux. When you swallow a circular band of muscle around the bottom of your esophagus, it should be lower esophageal sphincter. Relaxes to allow food and liquid to follow into your stomach. Then the sphincter closes again. If the sphincter relaxes abnormally or weakens, stomach acid can flow back up into your esophagus. This constant backwash of acid irritates the lining of your esophagus, often causing it to become inflamed. Lots of people are intimately familiar with acid reflux symptoms. More than 60 million Americans experience acid reflux at least once a month. Acid reflux disease is also known as gastroesophageal reflux disease. This can produce a variety of symptoms. First one is heartburn, regression, and dyspepsia are few of the most common acid reflux symptoms. Now we will see heartburn. Heartburn, also called acid indigestion heartburn, is a burning pain or discomfort that can move up from your stomach to the middle of your abdomen and chest. The pain can also move into your throat. Despite its name, heartburn doesn't affect your heart. Second one is regurgitation. Another common symptom of acid reflux is regurgitation, or the sensation of acid backing up into your throat or mouth. Regurgitation can produce a sour or bitter taste, and you may experience wet burps. Next symptom is dyspepsia. Many people with acid reflux disease also have a syndrome called dyspepsia. Dyspepsia is a general term for stomach discomfort. Symptoms of dyspepsia include burping, nausea after eating, stomach fullness or bloating, upper abdominal pain and discomfort. Symptoms of acid reflux may be sign that stomach acid has inflamed your esophagus. When that happens, stomach acid can damage the lining of your esophagus and cause bleeding. Over time, it can also change the cells of esophagus and cause cancer. Although acid reflux is extremely common and rarely serious, don't ignore your acid reflux symptoms. Making a new Making a few lifestyle changes and using over the counter antacid are often all you need to control acid reflux symptoms. When do acid reflux symptoms occur? Acid reflux symptoms most often occur after eating a heavy meal. Second, when bending over or lifting an object. Third, when lying down, especially on your back. People who have frequent acid reflux symptoms most often experience them at night. Nighttime GERT also produces the most pain. However, the level of pain doesn't always indicate the degree of damage to your esophagus. More than half of all pregnant women experience heartburn during pregnancy. Increased hormones and pressure from a growing fetus can combine to produce the acid reflux symptoms. In most cases, heartburn improves or completely goes away after delivery. So this time we will see what makes acid reflux symptoms worse. Certain foods can make symptoms of acid reflux worse for some people. To lessen your symptoms, try avoiding citrus fruit, chocolate, caffeinated drinks or alcohol, spicy, fatty or fried foods, garlic and onions, peppermint, tomatoes. Are there potential complications with acid reflux symptoms? Usually, acid reflux symptoms cause no complications. In a few cases, continued esophageal damage can lead to scarring, which may cause the esophagus to narrow. The narrowing creates structures and make it difficult to swallow. You may have dys- dyspepsia, a sensation that food is thick in your esophagus. In some cases, normal cells in the lining of the esophagus may be replaced by a different type of a cell. This is called Barrett's esophagus, which can sometimes develop into cancer. When should I call the doctor with acid reflux syndrome symptoms? Be sure to call your doctor if you don't get lasting relief from medications. Also, call the doctor right away if you have any alarm acid reflux symptoms such as these: unexpected weight loss, blood in vomit, black, terry or maroon color stools, difficulty or pain with swelling. Other acid reflux symptoms that should prompt a call to your doctor include asthma like symptoms such as wheezy or dry cough, horror senses, especially in the morning, chronic sore throat, hiccups that don't let up, nausea that lasts for more than a day or two. Sometimes people confuse the symptoms of heart attack with symptoms of acid reflux disease. That's because pain in the chest can feel like a heartburn. When in doubt, call your doctor. Symptoms of heart attack: first, chest pain, pressure or fullness lasting more than a few minutes or that goes away and comes back. Second, pain or discomfort in your neck, shoulder, upper back or jaw. Third one is shortness of breath with or without chest pain. Fourth one is dizziness, lightheadedness or nausea. The last one is sweating along with chest pain. So, if you have nighttime acid reflux, you might also experience with chronic cough, laryngitis, new or worsening asthma, disrupted sleep. So, this time we will see GERT treatment and home remedies. GERT treatment aims to cut down on the amount of reflex or lessen damage to the lining of the esophagus from reflex materials. Your doctor may recommend over the counter or prescription medication to read your symptoms. First one is antacid. These drugs can help neutralize acid in the esophagus and stomach and stop heartburn. Many people find that non prescription antacids provide temporary or partial relief. An antacid combined with a foaming agent helps some people. Research thinks these compounds form a foam barrier on top of the stomach that stops acid reflux. Second thing is H2 blockers. For chronic reflux and heartburn, the doctor may recommend medication to reduce acid in the stomach. These medicines include H2O, H2 blockers, which help block acid secretion in the stomach. H2 blockers include cimetidine, famotidine, and nisatidine. Third one is proton pump inhibitors. Also known as acid pumps, these drugs block a protein needed to make stomach acid. Next one is prokinetics. In rare cases, these drugs help your stomach empty faster so you don't have as much acid left behind. They may also help with symptoms like bloating, nausea, and vomiting, but they can also have serious side effects. Many people can't take them, and those who can should do so only for a limited time. Example of prokinetics include domperidone and metoclopramide religion. Diet and lifestyle changes. There are several changes that doctors suggest you make in your lifestyle to help lessen your symptoms of GERT. First thing is avoid foods and beverages triggers. Stay away from foods that can relax the LES, including chocolate, peppermint, fatty foods, caffeine, and alcoholic beverages. You should also avoid foods and beverages that can irritate or damage esophagus lining if they cause symptoms such as citrus fruits and juice, tomatoes products, and pepper. Second one is eat smaller servings. Eating smaller protein at mealtime may also help control symptoms. Also, eating meals at least 2 to 3 hours before bedtime lets the acid in your stomach go down and your stomach partially empty. Third one is eat slowly. Take your time at every meal. Next one is stop smoking. Cigarette smoking weakens the LES. Stop smoking is important to reduce GERT symptoms. Wear loose clothes. Clothes that squeeze your waist but pressure on your belly and the lower part of your esophagus. Final thing is acupuncture. In one study, treatment with acupuncture stopped reflex in the test group but better than PPI with result that lasted longer. We need more large studies to confirm this, but early results are promising.